Hi everyone, I'm back at DA. Here it is. Number 1. I bet you guys missed that, didn't you? The most important thing to keep in mind after your plastic surgery is applying ice packs. DA actually gives you ice packs, which I didn't know until I had my surgery, and so I was sent home with like a gift bag, and I was like, this is for me, but they give them to everybody. So these are the ice packs. I really like them. I still have mine just for when I need it, but it's important to apply the ice packs 48 hours after surgery, because in the first 48 hours is when you swell the most, so that's what will help you reduce the swelling. It's also helpful to use warm packs, but you should never apply ice packs or warm packs on areas where you've had fat grafting, and that's just because the survival rate of the fat that's been injected into your face can die really fast. So the warm packs that you use, they can facilitate blood circulation and can quickly absorb any swelling, but it's really important to be careful when you have ice packs or warm packs, because if you can't feel much in your face, you can either have frostbite or you can have burns, neither of which I would recommend. Don't have that, please. So just monitor them really well and make sure that you are taking care of those areas of your face. It's also important that you always put a gauze or a towel on your face pack, because it is very extreme of a temperature. So having something like a barrier over that area so your face is not dealing with extremes like full on is really important. I don't know if you guys can see this well, but they're really squishy. And this one is for your eye area, which again, I use this just because, like still. It's really nice and cooling, like that. And then this one is specifically for face contouring. It's also really squishy and nice. And yeah, so they give you these depending on which surgery you'll get. You might not get this one, but they're really nice. I love them. Number 2. I'm actually excited because, can you guys? This is the facial contouring mouth gargle that you have to have. And when you have facial contouring done, I don't know, some of you have probably experienced surgeries where you have to gargle. I know I did when I had to take my wisdom teeth out. And it's really important to like gargle once you've had like any surgery with your mouth, because you have to keep the area clean, and because you're always eating or like using your mouth often, it's important to have a gargle to just keep the area disinfected. So with facial contouring, you usually gargle every 2 to 3 hours, and after eating it's really important. You should gargle your mouth with clean water 10 times and then use what's provided. So you use water, then you use this, and then you should be pretty okay. It's also important that you gargle just because obviously when you eat, you can get food stuck in your mouth anywhere at any point. So it's best to just flush it out using your gargle. There you go. This is also, is this what you get?
Yeah.
You actually get this much? This is so much. I love this. That's okay. So when you get your present box that DA does send you home with, you get this much gargle. That's crazy. Okay, anyways. So for people who did breast augmentation, you shouldn't wear wire bras for at least a year after surgery, which I think is a great thing because wires are extremely uncomfortable. So congratulations. And the clinic will provide you with special bras that you should wear from 3 weeks to 3 months. I think it just depends on how you're healing, and is that what it depends on? Am I lying? Am I lying? So they will give you special bras that you should wear between 3 weeks up to 3 months. It will just depend on what they say after your surgery. I think it's different for everyone. And then afterwards you can wear wireless bras and sports bras. So, number 3. Number 3 is sleeping position. This is hard, but you have to do it. Listen to me. You have to do it. So, do you have to sleep while sitting down? Obviously not. You do have to sleep in a certain position based on which surgery you've had. So the most important thing that you should do is to place your upper body, like specifically your head, above your heart, because that reduces swelling. But, like for example, if you had a nose job, rhinoplasty, like some of us, me, for example, I couldn't sleep on my side. It was the most pain. It wasn't the most pain. It was fine. But I'm a side sleeper, so that was really hard. But if you have something like facial contouring, or honestly most surgeries where they're doing something to your face, you should probably avoid sleeping on your stomach or your side and sleep straight. That's also true for breast augmentations. You should sleep straight, and that's just because obviously while you're healing, if you're moving around in your sleep, that won't be beneficial to your surgery. You should also have pillows. I recommend more than one pillow. I had like 7, like they were just stacked on top of each other, and I basically slept sitting up. But you don't have to do that, of course. But like the higher your head is, the better, just in general. So there have been questions such as like, what if I accidentally sleep on my side? Like I wake up and I'm on my side from, the night. Or, what if I accidentally sleep on my stomach and wake up and I'm in a crazy position? Generally, it won't usually do much of anything. Like it's not gonna completely ruin your surgery per se, but it is better to start getting in the habit of sleeping straight on. Don't sleep anywhere else but you're facing forward. Just kidding. Number 4 is exercise. If you're anything like me, you probably don't do that. But for those of you who do exercise, this might be an important tip. Also, just like a lot of the other advice, generally speaking though, it's good to start going on walks 2 to 3 days after surgery. It doesn't have to be like an extreme marathon or anything like that, but getting up and walking around is really good at reducing the swelling that you have. But it can also help you with a quick recovery. A lot of you, just kidding, all of you, will be in Korea for your surgery with DA. But if you get like liposuction or breast augmentation, it can be a little bit different. You'll just have to consult with your doctor about it. But overall, it's a good idea to at least start walking. So I know at the moment it's a little bit difficult to avoid sweating, especially as it gets warmer, and we all have on masks. So immediately after your surgery, you should do your best to try not to sweat. Sweating enlarges the pores and can cause germs to enter your incision areas. That's also why you don't go to the sauna afterwards. But also damp, humid environments can lead to inflammation. You could get infected potentially if it's, severe enough. So another thing is when your body is swollen and is bruised, or you have any damage to it to any degree, it could cause blemishes. So all of that considered, it's best to avoid swimming, lifting weights, aerobics, and excessive exercise to any degree for at least a month. After that, it's best to consult with your doctor. Number 5. This is no drinking and no smoking. We talked about this, guys. We talked about this. I know it's really unfortunate. Drinking is really a large part of a lot of cultures, and it's a lot of fun. So for drinking, you cannot drink at least for a month. It depends on how well you're recovering, but at least a month. I know it's hard, you guys can do it. And then as far as smoking, cigarettes contain nicotine, so that helps, or doesn't help. Cigarettes contain nicotine, which can cause scarring, and it can also help with like things not healing properly. All of that is obviously very unwanted when you just had surgery, so you should also wait a month for smoking. That includes cigarettes, that includes hookah, that includes vaping. No, you can't do it. I'm so sorry. You also can't drink. Oh, wait, no, sorry. You also can't drink. I said yes, but really it was no. So don't do that. Okay, thank you. Number 6, this is about washing up and makeup. It's best not to wash the area where you've had your surgery until you get the stitches removed. So a lot of the time when you get your stitches removed, it's 1 to 2 weeks after surgery. So it can be a little bit uncomfortable and a little bit difficult, like if you aren't able to wash your face for 1 to 2 weeks, but you just have to stay strong, because the stitches, although like they could be removed, it doesn't mean that the area is completely healed. So even when you have those stitches in, like the area is still healing, it's best not to have the area wet or have any irritation. So like obviously soap, if you're washing your face and there was soap, that could irritate the area as well. So it's best to just avoid it. You should also be careful 1 to 2 days after getting your stitches removed. Again, just because that area is super delicate at the moment and it's not completely healed. It's still a very delicate area. When you have things such as eye surgery, it's really important that you don't rub your eyes or put on heavy makeup. Obviously that's just because the area is still healing and you want to make sure to keep the area healthy and clear of anything that will irritate it for as long as possible. Some people ask about whether they can apply additional ointments such as scar cream, but you should ask your doctor for that. I think everyone's different when it comes to stuff like that, so it's best to just ask your doctor. Another thing that you should be concerned about is makeup. You can apply makeup after having your stitches removed, but before that it's not recommended. It's also best just to have a thin layer or as little makeup as possible. That way it's best to remove it later, especially if you have things such as mascara or something that can be really thickly layered on. It can be really difficult to take it off. So if you just have a light thin layer of whatever you're putting on, it's way easier to take off later. I don't know if I should put a yes or a no. So makeup, no. Rubbing your face after stitches, no. Wet wipes, yes. Number 7. The most important thing, are you listening to me? Are you listening to me? The most important thing that you should do after your surgery is be cautious about what you eat. I know it sounds a little bit silly, I already had the surgery, why can't I just eat whatever I want? That's because whatever you put in your body could potentially reflect the outcome of your surgery. So the most recommended thing that we would say not to eat is high calorie foods, or your stomach is just in a really sensitive state, so it's better to eat something light instead of something that's really high in calories or dense. It's better to just eat lightly. So also with eating, you should also avoid spicy foods. It could cause swelling. And then when you have things like facial contouring, obviously it's a little bit different. You shouldn't have any solid foods for a week or more after surgery. So those are porridges you can have, soft yogurts, things like that are okay to eat, obviously. But of course, as we talked about earlier, you should gargle afterwards. So, breaking news, the reason that you don't have hot food or spicy food is because it raises your body temperature and can lead to infection. Boom. I didn't know that until today. But I didn't eat any spicy food or hot food, so don't do it. Don't do it. Number 8. Can you see? Okay. Another really important thing is medication. DA will give you your medicine as you leave surgery, so that part is covered, but they prescribe antibiotics, anti-inflammatories, stomach protection, and all of those prevent bacterial infections after surgery. So it's really important that you take your medicine, take all of your medicine as directed. Take it after you eat something. You can, have your food in one hand and your medicine in the other, and as long as you take it, you should be completely fine, because if you're not taking it, it could lead to negative side effects such as high risk of inflammation, infection, and it could just overall slow down your recovery process. So it's best that you take every single medicine that they give you. There we go.